Good afternoon, all of you. Thank you for joining today's webinar. Today we have two renowned doctors. We have Dr. Raghuteja, who's a very renowned laparoscopic surgeon. And we also have Dr. Tejasvi Rao with us, who is a very able and well-renowned neurologist. And we have very varied and very interesting topics today. Number one, Dr. Raghuteja will present how to reverse fatty liver, and Dr. Tejasvi Rao would present on stroke. How do we know that we have got a stroke, or what are the signs of a stroke? Okay, so first let's hear it from Dr. Raghuteja. Please go ahead, sir.
Yeah, thank you, Ajay, for a nice introduction. Now, I'm going to share my screen. How to reverse fatty liver. So, why we need to reverse fatty liver? So, we hear like reversal of diabetes, weight loss reversal, right? But no one talks about reversal of fatty liver, which is far more important than reversing diabetes or weight loss, because the complications of fatty liver, they are very I will tell you the complications of fatty liver, why we need to reverse fatty liver. Once if someone understands about this, then definitely they'll take their steps to reverse their fatty liver, or at least to reverse their metabolic problems. Like, the complications of fatty liver are, they may seem like it is a normal issue, but they will turn out to be like chronic liver disease or NASH, non-alcoholic steatohepatitis, we call it. Like, that is an inflammation of a liver. So there are different types of fatty liver, like non-alcoholic fatty liver disease. So basically, previously we are in a belief that fatty liver was caused only by alcohol, but this has gone in recent times that it is happening due to like diet, sedentary lifestyle, or sleep issues, or because of insulin resistance and all. So this is a high time that we need to reverse fatty liver, mainly non-alcoholic fatty liver disease, to prevent cirrhotic liver disease. So what do you mean by cirrhosis? You can see the diagram of the liver here. This is not a normal liver. This is all nodules on the liver. If the cirrhosis of liver happens, liver is the main organ where it helps in detoxification. The every toxin which enters the body, either it is a exotoxin or endotoxin, or whichever we eat through the diet, all those toxins are detoxified by liver. Whenever this happens, like fatty liver or cirrhotic liver disease, all those toxins accumulate in the body. There'll be protein deficiency and ascites type of picture. There'll be a liquid, we'll call it as ascitic fluid, that will be accumulated in the abdomen, which leads to breathlessness and pedal edema. And it disturbs the lifestyle of a human being. So I am directly entering into the reversal of fatty liver, not talking much about fatty liver, non-alcoholic, etc. Introduction is fatty liver is definitely, it is reversible, like how diabetes is reversible, weight loss we can reverse. In the same way, fatty liver is reversible if it is tackled in the early stages. So globally, 1 in 4 adults has fatty liver, often silently progressing. So the main aim of prevention of fatty liver is we have to stop the fatty liver itself, here itself, where it should not progress into the fibrosis or chronic type of picture, like cirrhosis or liver cancer, hepatocellular carcinoma, something like that. So this is the main goal or aim. Yes. So what are the main causes of fatty liver? Root causes, which are very important. If we know the root causes, definitely we can treat the fatty liver very well or prevent the fatty liver. The main thing is disturbance in fructose metabolism. What happens in fructose metabolism? Fructose is, it directly enters the liver, directly inflames the liver compared to glucose. And the metabolism of fructose is very much easy. That is, it bypasses all the routes of glucose metabolism. So it is very much easy, and and whatever the toxins which are produced due to fructose metabolism are too much more when compared to the glucose metabolism, which directly enters the liver. So this causes fatty liver mainly because of fructose metabolism. So where does we see fructose more is like corn syrups or any cool drinks or energy drinks which are selling more in recent times. All those have fructose mainly. So it is very important to see the ingredients in the ingredients list in the drinks or whatever processed foods, hot dogs or burgers, pizzas. All these easily includes like fructose or the glucose metabolism. Whichever the food is, whenever it is processed more, it creates fructose or glucose easily, it releases easily, and which in turn converts into fat. That fat it deposits on the liver, which leads to fatty liver. So this is one of the main root cause. Second is gut liver axis dysfunction. That is, whenever there is bacterial dysbiome, like if there is a SIBO, we call small intestinal bacterial overgrowth, or when there is gut permeability imbalance, when there is leaky gut, whatever the toxins or whatever the food we are eating, whatever the bacteria that is entering the gut, it directly leaks into the liver and it toxifies the liver. That is one more cause of like gut liver dysfunction. And small intestinal bacterial overgrowth, we call SIBO, it also leads to, again, the metabolites released because of those bacterial oxidation, or because of that it again leads to fatty liver. So then mitochondrial overload, what is mitochondrial overload is, mitochondria is one such structure in the cell. It is a cell organelle. It helps in energy, it helps in providing energy, it helps in oxidation. So whenever the quality, or whenever the time whenever the process of mitochondria increases due to toxins, because it detoxifies all the toxins from the body. Whenever the overload of mitochondria happens, this leads to, again, deposition of fat and oxidation imbalance of fat. So that is one more important thing, mitochondrial overload. Sorry. So one important thing to reverse is intermittent fasting. We call normally, but in scientific terms, it is like time restricted eating. So see, time restricted eating is in a specific time in a day. Say for example, 24 hours. You divide the day as like 8 hours, or 8 hours and uh, 16 hours, 16 and 12 hours. So that will be 24 hours, right? So in the 12 hours period, you will be taking some diet. The rest 16 hours, in the rest 16 hours, you need to fast. Because what happens in fasting is autophagy. There will be autophagy of the cell, which helps in improving the inflammation, and the cell will recover. This is how fasting helps. So one most important thing to reverse fatty liver is intermittent fasting. So we in our clinical practice, we advise most of the patients to follow intermittent fasting, mainly if it is like a grade 2 fatty liver or grade 3 fatty liver, intermittent fasting will help a lot, and low fructose diet again. Then high quality protein is very important. And anti-inflammatory foods. Why? Because again, oxidative stress is one important thing which leads to fatty liver. So to prevent oxidative stress, antioxidants we need. So antioxidants and anti-inflammatory foods will help. Those anti-inflammatory foods are turmeric, coffee, green tea, anything like it decreases inflammation, like green vegetables or high protein diet as well. Then coming to the exercise tolerance, one important thing is high intensity training. What is high intensity training? So for 40 minutes, it will be done for 40 minutes, and it is then we need to give some pause in between. So the high intensity training again helps to reverse fatty liver. So it may be cardio, it may be cycling. You will be doing for, you will divide the time, like in 40 minutes you will divide the time, like 10 minutes again, then 20 minutes, then again 20 minutes, but you will pause in between. You will be pausing for 10 minutes or 5 minutes in between. The heart rate, the maximum, it has to be, the heart rate has to reach like 85 to 90% of your maximum heart rate. This is called high intensity training. And one more thing is resistance training. Anything which resists against the resistance, the exercise has to be done. That is one more thing which helps in reversing fatty liver. Then standing, walking, anything like climbing the stairs also helps in reversing fatty liver. So one more important thing we advise to the patients is probiotics and prebiotics to improve the gut liver connection. So probiotics and fermented foods, if you take just there in market, there are many different kinds of probiotics, but my advice is curd itself is a very good probiotic. You can take curd every day or once in 2 days. That is one more important thing. So these probiotics, they help in reducing the inflammation. And prebiotics, coming to the, there is difference between prebiotics and probiotics. Prebiotics is nothing but fiber. Fiber again helps in reducing the inflammation of the gut. That is how it helps to reverse the fatty liver. So one more important thing is we need to avoid taking antibiotics on our own, like just like that people are going to the medical shop and they're getting their antibiotics. So it is very important to note that people need to avoid taking antibiotics unless it is very important. So in fatty liver, whenever there is some pathology in the liver, there will be a deficiency of four vitamins: A, D, E, and K. Vitamin A, vitamin D, vitamin E, and K. So what we suggest the patients is they need to take some vitamin E and D as supplements, vitamin A and K through veggies. So that is very important. And one more two important things which are trending these days is milk thistle. It is an antioxidant which helps for fatty liver. You can buy it online. And this is a proven research. There is a proven research paper on this, that milk thistle and berberine reverses fatty liver. Coming to the lifestyle and hormones, which is very important topic pertaining to fatty liver. Sleep optimization. In sleep, what happens if there is no proper sleep? One, there will be increase in ghrelin. Second, there will be decrease in leptin. Both these hormones disruption will lead to again fatty liver. One more thing which happens in sleep, in proper sleep, is there will increase in growth hormone. This growth hormone helps in reversal of fatty liver and improvement of insulin resistance. So that is an important thing which we need to focus on, prioritizing our sleep. Sleep in the sense, some people will sleep for like 12 hours, 14 hours. So that will also not work for a fatty liver. There has to be optimal sleep, like 7 to 9 hours. Full-fledged quality sleep is very important to reverse fatty liver. One more thing is stress. The increase in cortisol, which again worsens fatty liver. So there are different techniques to reduce your cortisol levels or stress. We need to focus on that. And of course, alcohol is like a poison, is like poison to liver. Even one drop of alcohol poison, if we take one glass or one drop, we call it as poison. So poison is poison always. So alcohol, even one drop or one peg or 90 ml, whatever quantity, doesn't matter. Someone has to feel that alcohol is like poison to liver, because it directly inflames the liver, which leads to again fatty liver. So PCOD and thyroid issues, they are metabolic issues which comes with fatty liver. If someone has hypothyroidism, which may lead to fatty liver. If someone has fatty liver, which again leads to hypothyroidism, because the oxidation and deoxidation or the metabolism of thyroid hormones happen in the liver itself. The conversion of T3 to T4 happens in the liver itself. So which may lead to hypothyroidism if someone has fatty liver. So it is very important to address this metabolic issue. Fatty liver is associated with diabetes, thyroid issues, PCOD, obesity. It is all a metabolic syndrome. So how we monitor the reversal, how we monitor the reversal stage is like we advise to do these tests like ALT, AST, SGOT, SGPT. These are liver enzymes which are seen in LFT. Then triglycerides, HbA1c is one important test. Then how fatty liver is diagnosed is by either ultrasound if it is in stage 1 or stage 2. If it is progressing to stage 3 or NASH type of thing, that we call as non-alcoholic steatohepatitis, the diagnosis is done by liver biopsy. So then we see the waist circumference also, because obesity is indirectly related to fatty liver. So all these things we monitor, we do the blood test, then we see the BMI of the patient, waist circumference, and imaging we do. If positive, if needed, fibro scans also we do. Then we'll see the progression of the patient, how the program is working. So these are the research articles: 12 weeks of Mediterranean diet, which includes high quality of vegetables, high protein diet with intermittent fasting, has reversed fatty liver in 12 weeks. This is a research article. And exercise without weight loss, even if someone is not losing his or her weight, but exercise definitely reverses fatty liver. So one is high intensity training, then high quality sleep, proper diet, and abstinence from alcohol, antioxidant rich food, probiotic and prebiotic rich food. All this helps in, and main important thing is intermittent fasting. All this helps in reversal of fatty liver. So if anyone suffering from fatty liver grade 1, grade 2, take your steps now to prevent NASH or cirrhotic liver disease. And if someone is suffering from grade 3 fatty liver, NASH, or cirrhosis, we are always there. We know how to treat. We have a team. So don't worry, you can contact us anytime. Thank you so much, Dr. Raghuteja, signing off. If you have any doubts, you can put in the comments. I don't know, Ajay.
Sure, sure. So as we come close to today's close of today's webinar, we would like to thank both our doctors for sharing their expertise and all of you to join us. We'd we'll move on to into a Q&A session. If you have any questions, you can type into the Zoom chat box, or you can even post your questions. I'll ask you to ask everyone to unmute and please ask your questions. I'd like to post a question to Dr. Raghuteja first. Doctor, Is fatty liver always reversible, and how long does it usually take?
Fatty liver, when it is in grade 1 and grade 2, it is very much easy to reverse. When it progresses to grade 3 or grade 4, or if it is in the NASH, NASH, we call it as non-alcoholic steatohepatitis and cirrhotic type of picture,
Mhm.
then it is bit difficult to reverse. Reason why grade 1 and grade 2 fatty liver, we need to be very cautious because it is very easily reversible. Whenever the grade increases, it takes bit a lot of time and efforts and some psychological issues pertaining to the patient as well. So the main important thing is prevention. As early as prevention is first important goal of the patient or any normal individual. We have to prevent that, but we have to prevent from getting a fatty liver. Whenever something like that happens, like grade 1 or grade 2, then it is very much easy to reverse by taking small steps. But grade 3 and grade 4, we actually prescribe some medications along with the lifestyle changes. Even grade 3 and grade 4 are also reversible. And cirrhotic, it is a difficult part to manage.
Mhm. Okay, great. Yeah, I think that was part of my second question actually. Can diet alone reverse fatty liver, or is medical treatment also needed? I think you
So,
already answered that question.
sorry.
My next question was, can diet alone reverse fatty liver, or is medical treatment also needed?
Yeah, that's what for grade 1 and grade 2, we'll treat with lifestyle changes. Grade 3 and grade 4, we'll advise some
Medication.
medications. And even surgical part role is also there for obesity. If the patient is obese and having fatty liver, then we'll advise bariatric surgeries as well, like sleeve gastrectomies to reverse fatty liver, because fatty liver is not alone. It comes with diabetes, obesity, and all these thyroid issues, metabolic syndrome, PCOD, something like that. So if it is in grade 3 and grade 4, we'll advise bariatric surgeries for some patients, even if they are not obese.
Okay, so patients with such comorbidities can even look for certain signs for fatty liver.
Of course, if someone is suffering from grade 3, grade 4 fatty liver and bit obese or super obese, then definitely we'll advise, we'll start with lifestyle changes. Then, if it is not working, then we'll advise some basic bariatric surgeries.
Great. Good to know, doctor. Thank you. Thank you very much. Thank you, doctor. Any more questions, you can always email us and we'll get back to you with the answers. Coming to the end of today's webinar, thank you, Dr. Tejasvi and Dr. Raghuteja, for sharing your expertise. And thank you, all of you, for joining us today. Your feedback is very important to us. So kindly take a minute to fill out the post-webinar survey, which will pop up after the session. You can, alternatively, you can also fill it up. It will be sent to your email as well. You can fill up there. It will help us improve and also plan future health talks on topics that matter most to you. So stay connected, stay healthy, and we look forward to seeing you in our upcoming webinars. Have a great evening. Thank you.